My name is Dr. Ann Johnson, OBGYN here at CCM Health. I went to medical school up at the Duluth campus, so it's kind of a blended campus. I did 2 years up in Duluth and then 2 years in the Twin Cities. I am board certified in all kind of realms of the OBGYN field. So FACOG is the official kind of title that comes along with being board certified. I'm a board certified OBGYN, so kind of full scope OB and GYN care is where I've been credentialed in. I do hold some additional memberships that kind of fill in line with my interests or special interests within the field of OBGYN. So those include the Menopause Society, ASRM, which is kind of the infertility realm, and then additionally the kind of laparoscopic or minimally invasive surgery side of the GYN world. My career in medicine started with just my interest in the science field. So my major in college was biochemistry and molecular biology. So I definitely had a strong kind of desire towards the science fields. And then kind of pairing that with my kind of innate desire to connect with people. And that led me to where I am. And whether I knew it at the time or not, definitely a career in women's health has been a really fulfilling and rewarding journey for me. I feel very passionate about the work that I'm doing. I think especially in women's health, it's a challenge to take time out of your day for many women to schedule their doctor visits. And so that barrier in and of itself is a challenge. And then I think a lot of the topics and things that come up at seeing a gynecologist are really, really sensitive. So whether it be abnormal bleeding patterns or heavy bleeding, pelvic pain or endometriosis, infertility or recurrent pregnancy loss, menopause symptoms, abnormal pap smears, gosh, the list just kind of goes on of the different things that come up at the gynecologist. And many of those topics are really challenging to discuss, but there's a lot that we can do to help people through that. So sometimes it's just basic lifestyle interventions, medicine, surgery, all those things come up, or sometimes it's a combination, or kind of we work through and march down the path of different options. Choosing CCM Health was a really easy choice for me. I've been living in the Wilmer community for the last few years, and I grew up in a rural community as well, so I know a lot about the ins and outs about living rurally and then now healthcare rurally. I know that there can be some real challenges in keeping a robust medical community close to home for our communities. When I kind of engaged with CCM Health though, I found that they were really innovative and really worked to overcome those challenges. It may seem effortless to them, and that's I think the beauty of it as well, is they've really been forward thinking and able to kind of remedy any of those issues and kind of stay ahead of the curve, keeping really quality care and passionate care close to home. So a little bit about myself. I grew up in Alexandria, Minnesota, so not too far from here. And like I said, I've been living in the Wilmer community for the last few years. My husband and I have 4 young kids, 3 boys, and then our youngest is a little girl. Our boys are really busy in the hockey world already, so we keep pretty busy chasing them around. We have 3 dogs, spend lots of time outside. So I'm very excited to both partner with the OB team and to continue the GYN care here at CCM Health. Yes, and when you're ready to schedule an appointment here with us in the gynecology department, just give us a call or visit our website.